This podcast is a member of the New York City Podcast Network at nycpodcastnetwork.com. Visit us to listen to over 250 amazing podcasts just like this one.
Japanese street style is some of the cutest and trendiest clothing in the world. Introducing Cherry Goddess Women's Clothing and Accessories, the hottest original and cute clothing company. We offer tops, clothes, accessories, shoes, dresses and skirts, and comfortable homeware that we guarantee you will love. Cherry Goddess Women's Clothing, super cute Japanese style clothing.
This is Black Wall Street Chronicles, and we're back at it again. Today I'm going to talk about the struggles of being an essential worker. I have not been recording the podcast lately because I am an essential worker. I work as a personal home health aide for my mom. And the experience has actually been very trying, risking my life going to the grocery store, and I could contract the virus, I could die, and I could effectively affect my mom. So this is not really a great experience, and I want to talk about this because I think all of you guys really need to stay home. You need to stay home so we can get through this as quickly as possible and less people will die. I'm currently living in New York City, and New York City is the ground zero. I'm on a bus getting supplies, getting things from my mom, and I see people on the bus who should not be on the bus. I see people who are elderly, people who are disabled, and I'm actually very sad that even in this time they have to go out and get supplies for their family. They should be at home. And the reason why they have to go outside because nobody really cares much about them, and no family members coming to help them and anything of the sort. Actually, very sad situation right now. So I'm going to read some articles about being an essential worker. The first article is from Business Insider. I went to their website. The title of the article is Essential Workers like Nurses and Grocery Store Employees will get a $25,000 raise for working through the pandemic under a new plan from Senate Democrats. That'd be great. I could use that raise. Well, bullet point 1. Essential workers like nurses and grocery store employees would get a $25,000 pandemic premium pay increase from a newly proposed plan for Senate Democrats. The plan to provide a COVID-19 Heroes Fund is intended to be a part of potential fourth coronavirus bill, Senate Minority Leader Chuck Schumer said. The fund will also provide a $15,000 recruitment incentive for healthcare or home care workers, as well as first responders to attract and secure a workforce to fight the coronavirus. Visit Business Insider homepage for more stories. Essential frontline worker, including nurses and grocery store employees, could get a $25,000 raise if a new plan from Senate Democrats become law. The plan calls for a creation of the COVID-19 Heroes Fund to reward, retain, and recruit essential workers. The fund will provide a $25,000 pandemic premium pay increase for essential frontline workers until the end of 2020, Senator Minority Leader Chuck Schumer said in a statement. Schumer said that doctors, nurses, grocery store workers, and transit workers are among who could benefit, though the plan leaves room to include more. The essentials set to receive the pay will get an additional $13 per hour on top of their regular wages, capped at $25,000. The full raise will be available to people making less than $200,000 per year. Those making more will be capped at $5,000 in bonus pay. The fund will also provide a one-time $15,000 hiring bonus for people listed to work as healthcare or home care workers, or as first responders, where severe staffing shortages impeding the ability to provide care during the COVID-19 pandemic. The plan includes provisions for federal employees such as Postal Service and TCA workers to receive the premium. Details of the plan are subject to change and is intended to be a part of potential fourth coronavirus bill that would need to be approved by congressional Republicans and the president. Speaker of the House Nancy Pelosi has said that she would support another stimulus package and said that last week that she would like to send more direct payments as part of her next bill. Give me a second. Let's read other articles. That's actually good because I could use a $25,000 pay increase. I'm going out there. I had to hop on a Westchester bus to go to BJ's to get some products on wholesale, and BJ's is crowded. Yeah, I gotta stay online because everybody has to comply with social distancing laws. It's only a group of people that's only allowed in the supermarkets and grocery stores at the time, and everybody has to wear their masks and their gloves, or you're gonna get really sick. This is another article for Business Insider. It says the majority of Americans say that Trump and the government are doing a poor job fighting coronavirus. A majority of Americans, 55%, now say the federal government has done a poor job preventing the spread of novel coronavirus, which causes disease COVID-19, according to a new CNN poll. Most Americans also said that Donald Trump could be doing more to fight the outbreak, and the majority, 52%, disapprove of the job he's done in handling the pandemic. Meanwhile, Trump has betrayed reporters who have questioned him on federal government's bungled response, scoffing at questions of the lack of a robust system of testing for the virus. Visit Business Insider's homepage for more stories. As President Donald Trump continues to urge reporters to congratulate him on the great job he's done in responding to coronavirus, rather than pressing him on the government's failures, a majority of Americans now disapprove of his handling the crisis, according to a new CNN poll. The poll found 52% disapprove of the way Trump is handling the crisis, while 45% approve. This marked an uptick from the same poll in early March, when the 41% approved and 48% disapproved. Meanwhile, a majority of Americans also now say that the federal government has done a poor job in preventing the spread of the virus. The poll found, and 55% also feel that Trump should be doing more to fight the pandemic. As of Wednesday morning, there were over 12,000 reported coronavirus deaths in the U.S. and nearly 400,000 confirmed cases. Trump ignored multiple warnings of the potential pandemic and downplayed the threat of the virus for weeks. Roughly a month ago, for example, Trump on March 9 tweeted, "The fake news media and their partner, the Democratic Party, is doing everything in their semi-considerable power to inflame the coronavirus situation far beyond what the facts would warrant. Surgeon General, the risk is low to the average American." The president has repeatedly said he's done a great job maintaining the crisis, even as the death toll continues to rise. The federal government has struggled to recover from the early stumbles, particularly in terms of testing for the virus. The Centers for Disease Control and Prevention sent out faulty test kits in February, which put the U.S. way behind the curve. Though testing capacity has increased, the U.S. still does not have a robust system to test people for the coronavirus and gain a full picture of the spread. Trump has scoffed at questions about this and dismissed a recent report from the Department of Health and Human Services Inspector General, which warned of severe supply shortages and testing delays at hospitals. States are supposed to be doing testing. Hospitals are supposed to be doing testing, Trump said on Monday. We're the federal government. We're not supposed to be standing on street corners doing testers. They go to doctors, they go to hospitals. Okay. It's an interesting article. Well, we're all struggling here during this coronavirus-19 epidemic. Um, the thing about CNN, even though I actually agree on how Trump is handling the situation, CNN is a little bit slighted to the Liberal Party, so I don't know if we can take anything that they say with a grain of salt. But, just follow the news yourself, guys, and keep yourselves posted. Let me read other articles about this COVID-19 epidemic. By the way, please stay home. When you don't stay home, you're going to get sick and you're going to die. Cannot stress that enough. Okay, this article is from the Cyber Infrastructure, CISA. They basically are a civil servant. They're basically a government agency that is under the U.S. Department of Homeland Security. And the article is Guidance on the Essential Critical Infrastructure Workforce. Right. As the nation come together to slow the spread of COVID-19 on March 16th, the president issued updated coronavirus guidance for America that highlighted the importance of the critical infrastructure workforce. The Cybersecurity and Infrastructure Security Agency executes the Secretary of Homeland Security's authorities to secure infrastructure. Consistent with these authorities, the CSA has developed, in collaboration with other federal agencies, state and local governments, and the private sector, an essential critical infrastructure workforce advisory list. The list is intended to help state, local, tribal, and territorial officials as they work to protect their communities, while ensuring the continuity of functions critical to the public health and safety, as well as economic and national security. Decisions informed by this list should also take in consideration additional public health considerations based on the specific COVID-19 related concerns of particular jurisdictions. The list is advisory in nature. It is not, nor should be considered a federal directive or standard. Additionally, this advisory list is not intended to be the exclusive list of critical infrastructure sectors, workers, and functions that should be continued during the COVID-19 response across all jurisdictions. Individual jurisdictions should add or subtract essential workforce categories based on their own requirements and integration. The advisory list identifies workers that conduct a range of operations and services that are typically essential to the continued critical infrastructure viability, including staffing operation centers, maintaining and repairing critical infrastructure, operating call centers, working construction, and performing operational functions, amongst others. It also includes workers who support crucial supply chains and enable functions for critical infrastructure. The industries that support represent, but not limited to, medical, healthcare, telecommunications, information tech systems, defense, food, agriculture, transportation and logistics, energy, water and wastewater, law enforcement, and public works. State, local, tribal, and territorial governments are responsible for implementing and executing response activities, including decisions about access and reentry in their communities, while the federal government is in a supporting role. Officials should use their own judgment in issuing implementation directives and guidance. Similarly, while adhering to relevant public health guidance, critical infrastructure owners and operators are expected to use their own judgment on issues in the prioritization of business processes and the workforce allocation to best ensure continuity of the essential goods and services they support. All decisions should appropriately balance public safety, the health and safety of the workforce, and the continued delivery of essential critical infrastructure services and functions. While this advisory list is meant to keep public officials and employees' identity essential work functions, it also for the reality that some workers engage in activity determined to be essential may be unable to perform these functions because of health-related concerns. The CISA will continue to work with our partners in the critical infrastructure community to update this advisory list if necessary, as the nation's response to COVID-19 evolves. Should you have any questions about this list, please contact the CISA at cisa.cisa.dhs.gov. Attachment: Guidance on the Essential Critical Infrastructure Workforce, Ensuring Community and National Resistance in COVID-19 Response version 2.0. Yeah, guys, so if you want to look at that particular article, you need to go to CISA under the U.S. Department of Homeland Security to get more information. I'm going to read more articles from this website. The importance of essential critical infrastructure workers. The functioning critical infrastructure is imperative during the response to the COVID-19 emergency for both public health and safety as well as community well-being. Certain critical infrastructure industries have a special responsibility in these times continue operations. The advisory guidance and accompanying lists are intended to support state, local, tribal, territorial, and industrial partners in identifying the critical infrastructure sectors and the essential workers needed to maintain the services and functions Americans depend on daily and that needs to be able to operate resiliently during the COVID-19 pandemic response. This document gives advisory guidance on defining essential critical infrastructure workers, promoting the ability of such workers to continue to work during periods of community restriction, access management, social distancing, or closure orders. Directives is crucial to community resilience and continuity of essential functions. CISA will continue to accept feedback on the list and will evolve the list in response to stakeholder feedback. We will also use our various stakeholder engagement mechanisms to work with partners on how they are using this list and share those lessons learned and best practices broadly. Feedback can be sent to cisa.citcat.ci. Hold on, let me say the website again. If you want feedback, it can be sent to cisa.cicat@cisa.dhs.gov. Okay. They have other parts of this, so what I'm going to do is, what I'm going to do is what I want you guys to do is I want you to go to the CISA Cyber Infrastructure. And if you go to the CIA Cyber Infrastructure, they should have all this information that will be applicable to the COVID-19 epidemic. All right. Let's look at. This is a good one. On Fortune.com, they have a list of essential workers, businesses, and employees during the COVID-19 epidemic. And what I'm going to do is I'm going to read the list. As more states like California, New York, and Ohio are ordering its millions of residents to stay home because of the coronavirus, the U.S. Department of Homeland Security has listed which industries and workers are essential to fighting the pandemic. This list of essential employees, which is advisory, not a federal directive, was made as the U.S. has more than 16,000 confirmed cases of the virus, according to the Johns Hopkins University Coronavirus Tracker on Friday. Okay. They want me to sign an account to read the article further. Let's see if I can get the list some other way. I don't have to pay no paywall to get information. I hate when articles do that. Stupid Fortune.com. List of essential workers in New York. Good. I went to NewYorkState.com. This is perfect. Governor Cuomo issues guidance on essential services under the New York State on pause executive order. Earlier today, Governor M. Cuomo announced he is signing the New York State on pause executive order, a 10-point policy to ensure uniform safety for everyone, and includes a new directive that all non-essential businesses statewide must close in office personal functions effective at 8 p.m. on Sunday, March 22nd. Guidance on essential services under the executive order is as follows. Essential businesses or entities, including any for-profit or non-profit, regardless of the nature of service, the function they perform, or its corporate or entity structure, are not subject to the in-person restriction. Essential businesses must continue to comply with the guidance and directives for maintaining a clean and safe work environment issued by the Department of Health. The guidance is issued by the New York State Department of Economic Development, DBA Empire State Development, and applies to each business location individually and is intended to assist businesses in determining whether they are an essential business and steps to request such designation. With respect to businesses or entities that operate or provide both essential and non-essential services or support, only those lines in the business's operations that are necessary to support the essential services. Supplies of support are exempt from the restrictions. The purpose of Executive Order 202.6 Essential Business means essential healthcare operations including, this is number one. Number one, essential healthcare operations including research and laboratory services, hospitals, walk-in care health facilities, emergency veterinary and livestock services, elder care, medical wholesale and distribution, home health aid workers or aides for the elderly, doctors or emergency dental, nursing homes or residential health care facilities or congregate care facilities, medical supplies and equipment manufacturers and providers. 2. Essential infrastructure including utilities including power generation, fuel supply and transmission, public water and wastewater, telecommunications and data centers, airports, airlines, transportation infrastructure such as bus, rail, or for hire vehicle garages, hotels, and places of accommodation. Number 3. Essential manufacturing including food processing, manufacturing agents including all foods and beverages, chemicals, medical equipment and instruments, pharmaceuticals, sanitary products, telecommunications, microelectrics, semiconductor, agricultural farms, household paper products. Number 4. Essential retail including grocery stores including all food and beverage stores, pharmacies, convenience stores, farmers markets, gas stations, restaurants and bars, but only for takeout and delivery, hardware and building material stores. Number 5. Essential services including trash and recycling collection, processing and disposal, mail and shipping services, laundromats, building cleaning and maintenance, child care services, auto repair, warehouse distribution and fulfillment, funeral homes, crematoriums and cemeteries, storage for essential businesses, animal shelters. Number 6. News media. Number 7. Financial institutions including banks, insurance, payroll, accounting, services related to financial markets. Number 8. Providers of basic necessities for the economic disadvantaged populations including homeless shelters and congregate care facilities, food banks, human services providers whose functions include the direct care of patients, in-state licensed or funded voluntary programs, the care, protection, and custody and oversight of individuals both in the community and in-state licensed residential facilities, those operating community shelters and other critical human services agencies providing direct care or support. Number 9, construction, including skilled trades as electricians, plumbers, other related construction firms or professionals for essential infrastructure or for emergency repair and safety purposes. Number 10, defense and national security related operations supporting the U.S. government or a contractor to the government. Number 9, essential services necessary to maintain the safety, sanitation, and essential operations of residents or other essential businesses, including law enforcement, fire protection and response, building code enforcement, security, emergency management and response, building cleaners or janitors, general maintenance, whether employed by entity directly or a vendor, automotive repair, disinfection. Number 12, vendors that provide essential services or products, including logistics and technology support, childcare and services. Logistics, technology support for online services, childcare programs and services, government-owned or leased buildings, essential government services. If the function of your business is not above, but you believe it's essential, or the entity providing essential services or functions, you may request designation as an essential business. Houses of worship are not closed. However, it is strongly recommended to congregate services be held for social distancing maintained. Businesses and entities that provide essential services must implement rules that help facilitate social distancing of at least 6 feet. Requests by businesses to be designated as an essential function as described above should only be made if they're not covered by guidance. Restrictions on requesting designation as an essential business. Any business that only has a single occupant employee has been deemed exempt and need not to submit requests to be designated as an essential business. Businesses ordered to close on Monday, March 15, 2020, under the restrictions of any gathering with 50 or more participants, including but not limited to bars, restaurants, gyms, movie theaters, casinos, auditoriums, concerts, conferences, worship services, sporting events, and physical fitness centers, are presumed to be compliant with the New York State issues restriction and must refrain closed or are not eligible for designation as an essential business for purposes of this guidance. For guidance on cleaning and disinfection of facilities, refer to the New York State Department of Health interim guidance for cleaning and disinfection of public and private facilities for COVID-19. Yeah, so anybody who's living in the state of New York, they'll basically have a list of essential businesses that is necessary. So you go on their website and they'll basically break down the order of Executive Order 202.6. All right. So in closing, I want everybody to stay home. I want everybody to be safe, and please follow my directions. Please social distancing. Wear a mask. If you're going to go outside, only do it for exercise, to get a breath of fresh air, or to go to the store and get some essential items. Thank you very much, and God bless. I hope y'all stay safe during this troubled time.